I'm briefly going to talk about spinal anatomy, and this is particularly in specific reference to the lower back, which we call the lumbar spine. Here we have a side view of the lumbar spine, and in the front here we have structures which we call the vertebral bodies. They're the main supporting structures in the lower back. And in between the vertebral bodies, we have this material here which we call the disc. It's like a shock absorber in our spine. Behind the disc, we have spaces where nerves can travel through. These spaces are called the foramen. The foramens are like tunnels, and our spinal nerves will travel through these tunnels as they leave the body and travel into our legs. In the back of the spine, here, we have a structure which we call the Spinous Process. These pointy, bony landmarks we can sometimes feel on our own backs when we touch our spines. Next to the Spinous Process, we have a structure that's called the lamina. And the lamina is then joined at every level with the level above through an area called the Facet Joint. And we have two facet joints on either side of the spine. So when we talk about a spinal level, we're talking about the space between one vertebral body and the vertebral body below it. So one spinal level will be this bone, and the disc in between. When most surgeons or doctors refer to a spinal level, they'll say the term L1, L2, or L2, L3, or L3, L4. They're referring to specific levels in the back. During a laminectomy procedure, which we'll talk about later, this bony structure off the back is removed. By removing this bony structure, the nerves underneath have more space, and that helps relieve pressure off nerves. One of the important aspects of this procedure is to preserve these joints, called the facet joints. As long as these facet joints are not damaged during the operation, patients do not have to worry about spinal instability or an unstable spine. Another common condition that can affect the spine is a disc herniation. In a disc herniation, the material in between the vertebral bodies will compress the nerve at that specific level. And most disc herniations will travel backwards. So a disc herniation from here will move backwards and compress the spinal nerve here. And in this case, patients will have leg pain. Down here is a model of what a spine fusion looks like. And in a spine fusion, the surgeon is placing metal and hardware to unite bones together so they don't move. This is typically done for patients who have an unstable spine. So as you can see, there are different procedures in the spine for different conditions.